This neck thyroid swelling transformation you will see in real time in next few minutes. In next few minutes I will show how we will do the neck thyroid swelling ablation without surgery, no cut, no incision, so there will be no scar. No general anesthesia will be used and the hospital admission will be only for a day. Today I am showing you live how I do the thyroid ablation in real time in ultrasound. You can see I am doing the hydrodissection to separate the internal carotid artery and IVC and the vagus nerve from the nodule in the lateral and the posterior side. You can see this is completely separate now. I will go little bit more posteriorly to hydrodissect the posterior part, upper and posterior part of the nodule. This patient, young lady, she had a big right thyroid lobe nodule. Maximum dimension is 4.2 centimeter. It is now, you can see I am in the upper part of the nodule. This is the upper part and this is the superior pole. The entire superior pole and the lateral side, the nodule is lateral and the posterior side, the nodule is completely separate from the internal carotid artery and the IJV. Or after anesthetizing the patient in that locally, that area, now I am going for dissection, hydrodissection in the medial side, that is the dangerous triangle from the nodule. Why it is dangerous triangle? Because the laryngeal nerve is, you can see I am doing the anteromedial part. Now I will go more medially to make the space for safe ablation or the safe ablation zone. Yeah, you can see hydrodissection is going nicely in the medial side, because here you can, in my left side, you can see the trachea is there, and just beyond the trachea there is the dangerous triangle, and I am doing hydrodissection now to separate the dangerous triangle from the abnormal nodule of the right thyroid lobe. Yeah, you can see this is nicely we are separating the medial side or the dangerous triangle from the nodule. Yes, now you can see we are in the superomedial part of the dangerous triangle, and now I am going down. Actually we need approximately 3 mm, but maybe slightly more, and it is good margin for our ablation. Now this is the inferior part, completely separated. You can see here, completely separated. Surrounding, I am coming up, and up to the upper margin also it is separated from the dangerous triangle, and it is in the lateral side where vagus nerve ICA is there, that is also completely separate. This is in the superior part. I am going down, 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 and completely separated. Now we got the safe zone to start the ablation. We have started the ablation now. Yeah, we are using, you can see in real time that we are ablating now the thyroid nodule, and by using the method which we call moving shot technique. And in the periphery you can see that there is the normal tissue also there. The patient came to us for non-surgical treatment, that is for microwave ablation for this goiter. And just I want to tell you here that the goiter means many patients come to us telling that he or she had the goiter, she wants the treatment. Goiter actually means any swelling in the thyroid, that is called thyroid goiter. But you have to differentiate it, that which goiter you have. Sometimes the patient will tell us that I am having colloid goiter. Colloid goiter means if your nodule or the swelling is due to the colloid accumulation, that is colloid is the secretion of the thyroid, and even the patient having the goiter of the thyroid swelling, which may or may not be the colloid, due to the colloid goiter. Goiter is simply means that the swelling of the thyroid gland is called the goiter. And in real time we are doing the thyroid. Real time means continuously observing in the ultrasound machine we are doing the ablation. That's why it is called the real time ablation. In real time on ultrasound, that towards the dangerous triangle we are doing the ablation, and we have started in the posterior part, and gradually from the posterior we are coming towards the anterior side. This is the ideal technique to do the ablation near the dangerous triangle. As we know that this side the recurrent laryngeal nerve is there, and we have to save the recurrent laryngeal nerve at any cost. So we are doing very carefully in this side. Now we are in the anterior most part of the dangerous triangle. We have to remember we use moving shot technique for thyroid ablation, unlike the liver tumor. Treated in the right side. We are coming from the bottom towards the top, that means from the lower side towards the upper side I am coming, and entire nodule is treated. This is the upper pole. We are coming down, now, and this is the lower pole. And this is the lateral side, and this side is the medial side. Entire nodule is completed, treated by ablation. There is a small nodule in the left thyroid lobe, around 8 mm in the left side, just near to the adjacent to the left ICA. Now I am doing the ablation of the same nodule. 1, 2, 3 ablations in moving shot technique, and it is done. In the intermedial part you can see this is one more small nodule in the anterior part of the left thyroid lobe. This is the second ablation in the same nodule. Yes, it is done now. Complete ভালো বুলি ভাবিছিলোঁ, কমপ্লিটটো ভাল হ'বই। আৰু আপুনি সার্জারি কৰাৰ কথা ভাবা আছিল নে নাই? ওপেন সার্জারি কথা ভাবা নাই না?
24 পৰা মানে সেইকাৰণে এনেকৈ ৰখি দিলোঁ। 2-3 months মানৰ পৰা
কেনেকৈ গম পালে?
নেটৰ পৰা এনেকৈ সাৰ্জাৰী কিবা টেকনিক আছে নেকি এনেকৈ। তাৰপিছত মানে ইউটিউবত এনেকৈ বাহিৰৰহে দেখা পাই থাকোঁ। মানে অসম স্পেচিয়েলি অসমৰ এনেকৈ চাৰ্চ কৰি এতিয়া
Hope you have seen this live case. We have done the bilateral thyroid goiter nodule ablation, microwave ablation in the same city. This is our lady patient. She is is having that goitrous swelling of the thyroid for a long time. But when she come to know that method by which without surgery we can treat it, she came to us yesterday and she consulted us, and today we have done the ablation and everything is fine. Whether for price, this is the ablation procedure, step by step I have shown you. Thank you.